Hi there. This is going to be a completely different video to what I usually put on. Obviously, car reviews and such. Of my cars that I've got and technology and places we've been. This is actually about my health. It's just, I felt that it was quite a good video to put out there. Whether it gets any views, whether it doesn't, just so that if anybody does watch it, they can understand a bit more about me. So, basically, I have a condition called cystinosis. And it was diagnosed when I was 18 months old. Now, cystinosis, as far as I'm aware, the parents each have a gene that in themselves doesn't cause them any problems. They wouldn't know anything about it. But if both parents have that gene, when they come together and create a child, then it can cause, then it causes cystinosis. So obviously my parents, they wouldn't have known any different, wouldn't have known anything. They had me, and I was diagnosed with cystinosis. Anyway, cystinosis is basically I'll just read it off this website so I don't think. It's a rare disease that is typically diagnosed prior to age 2. Well, as I say, I was 18 months, so, just less. And it's a genetic metabolic disease that causes an amino acid, cystine, to accumulate in various organs of the body. Cystine crystals accumulate in the kidneys, eyes, liver, muscles, pancreas, brain, and white blood cells. And without specific treatment, children with cystinosis develop end-stage kidney failure at approximately age 9. Right, so that is the fact. So, cystinosis, I was diagnosed 18 months, and my kidneys were failing. It's not just my kidneys that are affected in me. I do have cystine crystals in my eyes, for which I take eye drops 3 or 4 times a day to try and, obviously, it doesn't reduce them, as far as I'm aware. It sort of, tries to prevent them from building up, too much. Obviously, the more you use them, I imagine, the better it is. So, I use eye drops, Cysteamine, I think it's called, eye drops. And also to help with the accumulation of cystine crystals and other... sorry, I'm rambling now. I have got a thing up here. There's another medication I take called Cysteamine, which I've got here. I can actually show you. There, Cysteamine. And when you actually look at the specific detail of it, says here, it is indicated, the treatment of proven nephratic cystinosis. It reduces cystine accumulation in some cells of cystinosis patients, and when treatment is started, it delays the development of renal failure. As far back as I can remember, obviously I haven't got any facts from my mum or anything, but as far as I can remember, I've always been on this, whether it's been in tablet form or in liquid form. There is various things. I used to be on all liquid medication, but now it's all tablets. But that was, later on. So yeah, 18 months old, diagnosed with cystinosis, So yeah, for me, it affects my eyes and my kidney. I don't think there's anything with my liver and such like that, but it can affect anything, anytime, basically. And as yet, there isn't a cure. It's just medication that you use to control it, rather than cure it or combat it. Same thing, probably. To cope with it. So, Cystinosis, as I say. So, my kidneys were failing, and as I read there, it says that with that, you could be in full renal failure and needing a kidney transplant by the age of 9. Whether that was a UK website or whether it's an American website, I'm not sure, but I was told that as well. 9, 10. But anyway, I actually had, obviously all the years my kidneys were failing, medication, they were failing. Anyway, 2007, which is 9 years ago? Yeah, 9 years ago, when I was 16, I had a transplant. Yeah, 16, yeah. I don't know why, for some reason I'm confused then, but yeah, 16. So, it was a lot. It just shows, obviously, something, along the line must have been going right, because I'd managed to get an extra 7 years, from when they actually thought I would need the transplant to getting it. That was in July 2007. I personally, I know that's probably stupid, really, when it's such a big momentous thing, but I personally can't remember the date. My mum does, and she's got the thing. So yeah, 9 years ago, which is ridiculous to think, really. And I've had no problems particularly with that. Obviously, I'm on various medication and such, which I've got here as well. I can show you. So yeah, that was the thing. My kidneys were failing, and luckily, I managed to, before they fully failed and before I went on to renal dialysis, I could have a transplant. Usually what would happen, I think, obviously I can't be certain on this because it hasn't happened to me, that you would go on the list, to find a donor, maybe as you were getting below a certain amount. Your kidneys obviously hadn't completely failed, but they were getting there, and then you'd be put on a list. Luckily, my mum went for the tests to see if she would be compatible, see if she could give me her kidney. And very thankfully, she was compatible, and I'm always, I always am, and always will be, forever grateful to my mum. Because I think that is incredible, really. To donate, an organ, to anybody, but, to your family, to your son, as I say, I'm forever thankful. And, otherwise, obviously I would have had to go on a list and wait. I don't know how long. It could have been short term, could have been long term, you just take the chance. But yeah, obviously you have 2 kidneys, you don't actually need 2, so that was fine, everything worked out, blood tests, whatever, and Mum was able to give her kidney to me. I can remember when we were getting ready, it must have been a little bit before the transplant was due to happen, we actually went into the chapel, we were told to go into we were asked, that we'd need to see the vicar at this chapel in the hospital grounds before, the operation, and we were asked, was Mum receiving any money for the kidney? Was she giving me her kidney and I was giving her £25,000, something like this? All these questions just to prove everything was above board. No, but obviously it wasn't. But yeah, obviously it was, and everything was fine. And at first, when we went in, and obviously Mum went in first, took her kidney out, then I went in afterwards, and obviously, however long it went, the transplant. And at first, when the kidney was transplanted to me, it wasn't producing any urine. Everything was connected up, everything was fine. What we thought, and it wasn't producing any urine, which is what they need to see before they can possibly discharge you and send you home. And it wasn't doing so. So, I'm just trying to think now, because it was 9 years ago, and I think I was dosed with plenty of morphine because obviously there was quite a lot of pain for me. But I think they did a biopsy, which, they take a little piece of something to check how things are happening, to check what could be wrong, or, if there's anything wrong. Anyway, after, I think, a couple more days, something like that, it did start the thing and everything was fine. So I was in hospital 10 days, and I think Mum was in a week. Yeah, I think Mum was in a week and I was in 10 days, a little bit longer. Obviously, the hospital ward there. But same as the nurses and that was at St James's Hospital, Leeds. And, they were the best nurses you could have had, apart from one. But, she wasn't pleasant, but I'll gloss over that. But yeah, everything there was good. And so 10 days out, came away, came home, and obviously I was really, because I couldn't just get up and move about and walk about, because obviously I was in, quite a bit of pain and various things. It must have been fluids and such, I can't remember now, but it must have been fluids and such anyway, that, I was quite, I know I'm not thin now, but I was quite blown up in the face and that, so when I got home I had to get in bed, raise my feet up, for the water to drain out type of thing, and gradually get, back to how I was. And when I'm thinking about it now, you can't really believe it's 9 years, because a lot has happened since then, in the time in between. But yeah, so obviously when we're in there, one of the things I was worried about, and obviously it's probably just me because I do worry a lot about, little details and different things, I do worry. One of the things was you got given a little book and it said all about things. It says like, I'm sure it said like how to store your tablets, what, I think a specific thing was about which tablets you had, that was depending on whichever patient. What you should do, what you shouldn't do, what you should eat, what you shouldn't. And the nurse that was on the thing, I was really worried because it says, if you look through this and I'll come back later on and ask you a few questions. And I was really worried that you sort of had to memorise whatever you was reading in this book, And the thing about it said, oh no, it's fine. But, I was really worried. But anyway, that was fine. I came home and I've still got that book now somewhere. And obviously it tells you all about things. Obviously I've got to watch my potassium levels. The various things since the transplant. I've got to watch my potassium levels because if they go high. I've got to put sun cream on when I go outside, a high sunscreen factor. Because now after the transplant, skin cancer is a high, a higher possibility, than before. Various other things I can't quite remember now, but as I say, there is the book that, But yeah, so after that, so right, tablets I'm on. I just wanted to go through these. I'll try not to be long because obviously we're already at 11.5 minutes. So yeah, Cystagon, obviously that is for the. I've got my calendar up here for some reason I can't see. Yeah, so Cystagon there is the accumulation of crystals. That's trying to help. Also, I've got the eye drops as well, which downstairs in the fridge. They need to be kept cold. That helps 3 or 4 times a day. Then obviously I've got anti-rejection tablets. So obviously even 9 years on, if I stopped having these, the kidney could reject and I'd have to go back into hospital. So one here, it's Prograf, or tacrolimus is the name I use, 1 microgram. So that's a anti-rejection tablet. Then here I've got, trying to figure out a way I can show you, because one side's got my name on. That one there, Celcept or mycophenolate, that's 500 micrograms. That is an anti-rejection tablet. And also, I haven't got it here, but that's the 1 microgram. Oop, nearly the name there. And there's also 0.5 micrograms. So, doses change very regularly, or used to do. Maybe not so much now, but they used to change very regularly. So I'd used to be on like 5 micrograms of tacrolimus in the morning and 5 at night. So I could have, I'll do it the right way now, 5 of those, or 4 of those and 2 halves. Yeah, to make up the 5. However, I was on 2.5 or whatever, where the halves come in handy. Then, I'm just trying to think. So yeah, then I've got levothyroxine here. Yeah, this one, levothyroxine tablets, and this is 50 micrograms and 25. Take them on alternate days. 50 one day, 25 the next, 50, 25. And that is, I also have an underactive thyroid. Is it underactive? One or the other, sorry. Hypothyroidism, which I did actually get up here because I wasn't actually sure. Where are I? Did I have it up? Yeah, an underactive thyroid, sorry, yeah. Hypothyroidism, where your thyroid gland doesn't produce enough hormones. So, you need to take these tablets help with that. Levothyroxine. Another one I've got, amlodipine, which I'll just have a quick gander because I can't remember. I think that's medication used to lower blood pressure, yeah, and prevent chest pain. May also be used for heart failure. Long-acting, yeah. So yeah, that's to lower blood pressure because my blood pressure is generally quite high. I've also got another one, ramipril, which I'm not sure if. That's to treat high blood pressure. So whether I'll have to see that next time we go. Whether that's whether that counteracts with this, I don't know. But I'm sure the doctors know what they're doing. But yeah, I've also folic acid as well, which is iron. Not enough iron in my thing. So yeah, and then I've got sodium bicarbonate, not bicarbonate of soda. Which is a salt. In the past, treatment of cystinosis was limited to treating metabolic acidosis, and now trying to see where it says. Must work with the sodium. Cystigon, sorry. Because I can't actually see. But it says, you know, it's for rare diseases. It says there, yeah. Cystinosis is treated symptomatically. Renal tubular dysfunction requires high intake of fluids and electrolytes. Sodium bicarbonate and potassium citrate, which I used to be on, I'm not on it anymore. Maybe maintain the normal balance. Yeah, so that is to keep things at a level with the electrolytes. And I think that's it. Yeah. And then they have been changed a couple of times since. I know this is a long rambling video, but nearly end of it. But yeah, I'm forever thankful to Mum. You know, really am, that everything went well there. And as I say, it could still affect other parts of my body, you know, and obviously in the future it could still fail the kidney. But I really, the position I'm in now, you know, I feel alright. I've obviously still got the scar, obviously, you know, scars, whatever, still there. And I was going to say, I've actually got 3 kidneys inside because it's easier to keep. Obviously, you have 2 as standard, but instead of removing the old one because it's, you know, they don't do it now or something, instead of removing the old kidney, or, you know, whichever, old kidneys, should I say, they leave them in and put the new one in as well. So I've actually got 3 kidneys, 2 not working and 1 working. So, thanks. So yeah, I go for regular blood tests, obviously, you know, to make sure everything's fine. And cystine levels and creatinine levels, everything to do with the kidney to make sure that everything's fine. And obviously, when I go for the blood tests and I go to the my doctors at the hospital for the results, you can see the tacrolimus levels, everything, you know, the levels of the anti-rejection drugs in the body, see what they're doing, you know, to make sure everything's fine. So hopefully, you know, well, for the time being, everything seems to be okay. Hopefully it carries on that way. And obviously at the minute, you know, it's just a case of keeping going with the tablets and seeing how it goes. But yeah, it'll be 9 years at the end of July. And so that's quite a thing. Next year, obviously 10 years, which is pretty hard to believe. But it's all thanks to my mum, you know, for being there. So I just want to say thank you very much to my mum, and if she does watch this video. So yeah, thanks very much. I seem to have rambled on and on and on, and then I can't think, but I seem to have missed out on a few things. If I have, I'll probably put them in the comments section or the description of this. But thanks very much for watching. If you have been, thank you.